Welcome to today's Scientists Answer Your Questions webinar brought to you by GrassrootsHealth. Thank you for attending. Today we have a special double broadcast with two separate interviews. First, Carol Baggerly, Director of GrassrootsHealth, will interview Dr. Thomas Burne of the Queensland Brain Institute on vitamin D in the brain. Following, Dr. Kelton Tremellan explains about vitamin D's role in both male and female fertility. Both interviews were recorded at the Linus Pauling's 2013 Conference on Diet and Optimum Health. Dr. Tom Burne is part of the Queensland Centre for Mental Health Research and has been with the Queensland Brain Institute since 2005. He has published over 70 referred papers and book chapters, is a member of the University of Queensland Animal Ethics Committee, an academic editor for PLOS ONE, and is on the executive committee for the Australian Society for Psychiatric Research. And with that, we are pleased to bring you this interview on vitamin D and the brain.
We have the pleasure today of having with us Dr. Thomas Burne from the University of Queensland in Australia, and his topic at his presentation yesterday was vitamin D and the brain. So we have invited him to join us to tell our audience about that. So, Dr. Burne, please proceed.
Hi, how you going? So we're interested in vitamin D in the brain, and we came to be interested in vitamin D from looking at the epidemiology of schizophrenia. There's a very widely reported seasonal of birth effect on schizophrenia, so that people born in winter and spring are more likely to get schizophrenia. And there's a couple of plausible explanations for that. It could be because coming out of winter people get more infections, and that is indeed a risk factor for schizophrenia. But it's also that people could have low vitamin D levels. And so we've spent the last 10 years looking in animal models about what vitamin D, or specifically low levels of vitamin D, would do to a developing brain. And so we have a particular animal model where we feed rats vitamin D in the diet, or we can feed them a diet that's completely deficient in vitamin D. And so we mate those rats, and then when they give birth we put them back onto a diet that contains vitamin D, so that the animals then grow up with normal vitamin D levels until adulthood, and we have a transient prenatal deficiency of vitamin D. And when we look in those animals, we see a whole series of changes in the brains of the animals, and we see long-term consequences to behaviour. And so some of the changes we see in the brain are all related to vitamin D's anti-proliferative properties. So when we take vitamin D out, it's as if we've taken the brakes off. So we get much more proliferation, we get changes in brain structure, we get changes in neurotransmitters that are relevant for schizophrenia, such as dopamine, glutamate, GABA, so major excitatory inhibitory neurotransmitters. And then when those animals grow up, so we're very careful to make sure that calcium levels are normal, so it's not a rickets model, so they're just low in vitamin D, normal calcium. If you look at the adult animals, you couldn't tell the difference between the control and the animals that were deficient during pregnancy. And when we test them on tests that are relevant to schizophrenia, for example, we expose them to drugs that would induce psychosis in people, such as amphetamine, or specific NMDA antagonists like MK1, we see an enhanced sensitized locomotor response, which in terms of animal models of schizophrenia we read out as a psychosis-related behaviour. And so these animals that have prenatal vitamin D deficiency are also sensitive to antipsychotics, such as haloperidol. And we also see effects on learning and memory and aspects of cognition. So although these little rats don't have schizophrenia, they've got features that you would expect to see in an animal model of schizophrenia. So what we've shown is that low transient deficiency in vitamin D during a critical period of brain development, during pregnancy, has long-term consequences on brain function and behaviour. So
You mentioned during the critical period of brain development. I don't know what the gestation period is with mice, rats, whatever, but where is that in the cycle, in that total period? Do you know that?
So a rat has a gestation of 21 days,
Okay.
and when the rat pups are born, she has a litter of, say, 12 pups, so it's
Okay.
quite different to humans, and they're very underdeveloped, very underdeveloped. Their eyes are closed, their ears are shut. When they're first born, they can smell and they respond to tactile cues. And then over the first 2 weeks after birth, they gradually open their eyes, their ears unfold, they start to get hair, and probably about 2 to 3 weeks of age is the equivalent time in brain development that a human baby would be born.
Wow.
So gestation in a rat is probably the same as the first 2 trimesters of human pregnancy. And so with our repletion, when they give birth, we put them back onto a vitamin D containing diet. So by the time they're weaned at 3 weeks of age, their vitamin D levels are indistinguishable from control animals. So they're probably exposed to about 5 weeks of deficiency in total.
Okay.
So it probably relates to most of pregnancy in a human. The other thing about humans is there's a critical period after birth out to about the first year of life. We're probably not capturing that within our model, so we would be looking at earlier periods. But I think typically if a woman were to get pregnant and then do something about it, maybe that wouldn't be until late first or early second trimester anyway. So perhaps we are modelling more what would happen in people that have not yet started to supplement and are already deficient. But there is... so within our model, we put them back onto a vitamin D containing diet and they replete within 2 to 3 weeks. It's possible that that is contributing to the adult phenotype in our model. So we've been a little concerned about that. So at the moment, we currently have a grant application in to look at various time points for repletion. Because it may be that if you were, say, pregnant, a pregnant woman, and you find out that you're deficient, and say late trimester, you suddenly take a very high dose of vitamin D that wouldn't otherwise cause any problems. Maybe for the fetus, because it's so anti-proliferative, maybe that does things to the developing brain that are not ideal. So I think based on our work, we would probably recommend similar things to folate, so that your levels of vitamin D would need to be normal prior to conception.
And don't you feel like saying, yes, yes, yes? I mean, you've got to do this.
Definitely.
Please, okay. Are you familiar with the gentleman by the name of Paul Patterson?
So Paul Patterson, I know, is a man who works at Caltech, who looks at immune infections, immune activation.
Yes.
And so I think a lot of that activates IL-6 in mouse models. So, I mean, vitamin D interacts with immune function and cytokines, and I think it would be very interesting. So if you have low vitamin D levels, you're probably more... you could be more affected by exposure to viruses or bacteria. The only trouble with our mouse models is that mice that are completely deficient in vitamin D are unable to mount an immune response. So I think the levels of deficiency that we might use in an animal are very rarely seen in human populations. So we can take the rats and mice down to almost undetectable amounts of 25-hydroxyvitamin D, which I don't think is clinically relevant. The other thing that we're going to be looking at in the future is looking at levels of insufficiency. So we've been modelling frank deficiency, but we would really like to start looking at insufficiency and more chronic insufficiency.
Dr. Patterson wrote a book, and I can't remember the title of it, but it was in infectious diseases of the brain or something, but it was all about the prenatal period. And he included schizophrenia in that, as well as possibly, we have an hourly chime now, so. Anyway, there is, as you know, more and more attention to this whole prenatal period for animals, for children, for everything. And just yesterday, the talk by Kent Thornburg and the fetal period, and as a predictor of chronic diseases in later life. It's rather stunning, isn't it?
To me, it isn't. Working with animal models and looking at development, I mean, I have known for a long time that disorders like schizophrenia are neurodevelopmental disorders, and it's things that happen very early on in brain development. So to me, as a basic researcher, it doesn't come as any surprise that these very early periods are fundamental to laying down a normal brain.
Then I have to ask my public health question, and I'm in that whole thing. A few years ago, I really thought that it was the vitamin D research message that wasn't getting out, and so we launched Grassroots Health in order to do exactly that. And I'm very excited about what we have done and are doing. And the more I listen to the researchers even here at this conference on the micronutrients, it's like the word's not getting out about any of these things fast enough. I mean, it's getting out, but the general public does not know these things, and they certainly aren't taking action on it because they don't know these things.
I think it's a difficult one. I think there's a very confused mixed message going out.
Yeah.
So, for example, in Australia for the last 15, 20 years we've had a slip, slop, slap campaign,
Okay.
which is about exposure to sun.
Oh,
So,
yes. As we do here in the U.S.
So there is definitely a problem with skin cancer, melanoma.
Right.
Some of the rates are some of the highest in Queensland, the state that I live in.
Right.
And so they're strongly advocating protecting children from this exposure to sun. The trouble is, it's preventing exposure to the sun for the benefits, which are vitamin D. Now, it seems quite clear that once you get sunburned, any beneficial effects of the sun for vitamin D are lost. So the critical thing is to never get sunburnt. But nobody really knows. My skin is slightly different to your skin, depends on the time of year, the time of the day, how long it's going to take for me to get burnt. And so the blanket message that everyone remembers, every mother will not let their child go to school without a hat on. In fact, schools have a no hat, no play policy.
Oh my.
Because they're so worried about skin cancers.
Oh my.
Now, I have many members of my family who've had skin cancers cut out, who've been diagnosed with melanoma, and it is a real problem. Whereas mild vitamin D insufficiency hasn't caused any problems so far in our family that we know of. So I think the general public would say, well, cancer's a big problem, a little bit of vitamin D deficiency, I haven't got rickets, is there any point in doing anything about it? Now the follow-up to that is that as soon as my wife was diagnosed with melanoma, had the operation, she's fine now, the doctor said you need to be taking vitamin D supplements and recommended 2,000 international units a day, which is what she's taking. And it's places like this conference where you realise the beneficial effects of vitamin D for things like reducing cancer incidence, reducing tumour growth. There are many benefits that are being lost with this overall message of beware of the sun, it's going to cause a lot of problems. And I think that's what creates the problem with the message. All mums want the best for their kids, so they think, I'll put a hat on.
Of course.
And they don't want to give their child a peel or something, so I guess the problem slips through. Even if you had someone who was convinced that you should supplement yourself or your child with vitamin D, there is a very confusing message about what level to use. So I think everyone talks about this 400 international units of vitamin D, which...
From our standpoint, the message about vitamin D supplementation is a little bit backwards, and it shouldn't be focused on how much to take, but what your serum level is. And that really resets the whole thing. And one of the first things that we got out of the first paper that we published was, given an intake level, you can't tell what somebody's serum level is.
Not at all.
Somebody taking 2,000 IU might be at 20 nanograms per milliliter, 50 nanomoles per liter. They might be at 100. You don't know.
That's true.
Because everybody's absorption of that is quite different. So we truly advocate people testing their vitamin D level, at least to get a baseline and a follow-up to see how they respond to anything. But please come back to the sun and that whole message, which truly is throughout the world. It's either culturally, like for example in wearing clothing which totally covers oneself. The research that I have read about the different skin cancers like the basal and squamous cell, mostly what I see is that they can be cut off or burned off if you're paying attention to them. But the people who are tanned have a better prognosis with those, and even with melanoma, than those who have never been out in the sun. So I think the message is very mixed and very poorly presented for health. There was just a study done that was published out of Scotland, I believe, with, and actually a dermatologist, Dr. Weller, was on the publication list, that the sun also, and here's where I think we're going to be able to save the sun. It's not going to be with vitamin D. We can take a pill for that, maybe. But it also creates nitric oxide in the body, which seems to have, it does have a vasodilating effect, and then allows a lowering of blood pressure. And if we could do something about the blood pressure thing, due to sun exposure, that really outweighs the number of people that might get some kind of skin cancer as a public health issue.
Yep.
Any comments on my soapbox there?
So as for blood pressure, I think some of the biggest factors that can help is diet and exercise.
Oh, of course.
And usually with exercise, going for a run or a walk or riding a bike, you're outside. And you don't need much exposure to sun to actually synthesize vitamin D. So I think within those recommendations, it's going to be a good thing to recommend people be outdoors.
Sure.
But I think that you still need to have the message that you should never get sunburned.
I think don't burn, don't burn, don't burn
So
is the
to
message.
see these teenage girls,
Yes.
rubbing oil and sunbaking on the beach, particularly, tourists that come to our
Sure.
Australian beaches, you just think you're crazy.
Sure.
But I don't know how, particularly with young people, or particularly young women who are about to be pregnant and 50% of pregnancies are unplanned, they wouldn't necessarily be aware of those things. So
Right. So we've got a lot of work to do.
we do.
Tell me a little bit more about, I appreciate the focus on schizophrenia, but can you tell me what other behavioral or other outcomes you have seen as a result of the vitamin D deficiency?
So the development of vitamin D deficiency in our outbred rat model is fairly subtle. They don't have large holes in the head, they don't look as if they're crazy, they don't do really strange things. They're very subtle and we have to push them to see these differences. And many baseline measurements are actually quite normal. We have started to look in some mouse models, mice and not just small rats, and looking at adult vitamin D deficiency. And in some vulnerable strains, what we're seeing is that those animals are showing cognitive deficits.
Okay.
Now, these are not old animals. They're maybe 3 to 4 months of age. They've been vitamin D deficient for 6 to 8 weeks.
Right.
And on tasks, attentional tasks that we have, essentially we can train rats to nose poke into little holes when a light comes on. They just have to sit there paying attention to this array, nose poke as soon as they see the light, they get a little food reward and they come back and pay attention. And so the animals that are vitamin D deficient take a little longer to learn that task.
Okay.
So we think that there's some beginnings of some attentional deficits. Now we haven't started looking at older age mice, but we would predict that you would have more of an effect of vitamin D deficiency as the animals age.
Sure, sure.
So again, it's subtle. We're not interested in looking at rickets. So if you have severe deficiency, particularly in rodents, they you affect bone health and they become weak. We've looked at animals that have the vitamin D receptor knocked out. They lose all their hair because vitamin D receptor is involved with hair folliculogenesis. But they also have muscle weakness. They start to get osteoporosis. We have to supplement them heavily with calcium. They can't swim very well. They lose the ability to float properly, and they get lots of problems. We were concerned early on when we were looking at the role of vitamin D, because that's not what we see with schizophrenia at all. And in fact, some people have looked at polymorphisms for the vitamin D receptor and seen if it's associated with psychosis, and it turns out that it's not. So it seems that it's the 25-hydroxy vitamin D levels that are important, and deficiency in that during development or in adulthood has subtle effects, but they're very clear and they're easily reversed or treated with 25-hydroxy vitamin D. So as a safe, cheap, easy way to reverse some of these deficits, it seems like a fairly straightforward thing to do.
You mentioned reverse these deficits. Come back to that a minute, though, please. If the mouse has this, mouse or rat, excuse me.
So we've done stuff in
Clarify
rats
my-
and rats and mice.
With the schizophrenia.
So when
Once they've got it, do you really get to reverse it, or do you just get to prevent it by having the...
So we have done some studies where we vary the amount of deficiency. So we might make them deficient prior to conception, then at conception put them back onto a diet that contains vitamin D, or start deficiency at conception and then put them back on the diet at birth, or put them back on when they're weaned a little bit later on. So if we vary that exposure period, there's a critical period late in gestation for the rat when they need vitamin D, so if they don't have it we see the problems. And if we extend the vitamin D deficiency out to weaning, the effect on the brain seems to be worse than if we replete them at birth. So if we can limit the exposure, we have less adverse effects. We haven't, strictly speaking, done the study where we make them deficient and then as an adult look at their behaviour and then try and give them some vitamin D therapy, because in that model their vitamin D signalling pathways are completely normal as an adult. So what we think we've done is we've just transiently disrupted the orderly trajectory of brain development.
Okay.
So that might be harder to treat.
Yes.
In one of we had a paper out earlier this year where we looked at some cognitive deficits. It was a response inhibition deficit, and when we treated those animals with clozapine, we could reverse the deficit.
Okay.
Which was quite unusual because usually clozapine's not that good for reversing cognitive deficits. But there might be other pharmacological treatments that can reverse some of the deficits from this transient depletion. With our adult vitamin D deficiency mouse model, we're actually going to be looking at trying to reverse those deficits with things like D-cycloserine or vitamin D acute treatment. I mean, the difficulty with vitamin D is it's very hard to get the levels back up quickly.
Yes.
It takes maybe 2 to 3 weeks to fully replete. So it's a little bit hard in the animal studies to take it off and put it back on. So that's going to be a challenge for us to work out how vitamin D is acting.
It will be really interesting as you go forward also to see this idea of making them well again. I am still intrigued by as a possibility, like the very fact that some of the cancer studies have shown, like what David Feldman presented the other day, we give them lots of vitamin D and all of a sudden their tumor gets smaller and in some cases even goes away. There were some CT scans of someone who had multiple sclerosis that was treated with extremely high levels, like 50,000 IU a day of vitamin D, and all of a sudden the lesions in the brain literally went away. So when we look at some of these other diseases, like schizophrenia, it will be interesting to see in your animal models if you really can reverse it.
Yeah,
by
definitely.
giving obviously an unusual amount of vitamin D, but what do you think?
Well, so there's two things to say. Firstly,
Yes.
just coming back to the schizophrenia, there's
Yes,
a clinical
please.
trial about to start where they're looking in patients that are resistant to clozapine and they're
Okay.
giving them an adjunct therapy of vitamin D treatment with the clozapine. Now, the trouble with many patients is they're vitamin D deficient.
Yes, of course.
But we don't know about whether the adult vitamin D deficiency is causing or contributing to schizophrenia, or it's a consequence of having schizophrenia and they're less likely to go outdoors, they have more dysfunction, so they
Sure.
don't eat properly, and so maybe that's, it's because of the schizophrenia, we're not quite sure. With MS, there's certainly a lot of case studies. We have colleagues in Marseille, Professor Francois Ferron,
Yes.
who is very interested in multiple sclerosis and talks of patients who are given vitamin D therapy and it actually treats and in a sense cures the MS. So I don't know if that's if that's just individual cases or if that would happen for everybody. Certainly in our mouse models, when you make them completely vitamin D deficient, they're unable to mount an immune response. Which is not exactly what you would see in a human population. So there's a limitation with some of our models.
Of course.
But it's tantalising if
Isn't it?
vitamin D treatment could reverse some of these.
Isn't it?
It's just, that would be fantastic if
Well, I
it
think
would be true.
that part of what is completely tantalizing to me as a prior recipient of chemotherapy is if I had known then what I know now about vitamin D, I would say no, I don't, even though I had a more advanced cancer, I would say no, I would rather be treated with a very high dose of vitamin D for the next 12 weeks or whatever, and let's see what happens.
Yep.
Because the toxicity of vitamin D is very minor, even if you get hypercalcemia, which you may not.
I mean, I think we heard that at this meeting.
We did.
There is a risk of hypercalcemia,
There is.
but considering the risks of chemotherapy,
Oh my God.
it just disappears
It
any
does.
sense of hypercalcemia.
It does.
And if you have normal kidney function, you should be able to regulate calcium, excrete excess calcium. There is some people are worried 50,000 international units of vitamin D given to a rat will die of a heart attack straight away, and it's used as a rat poison.
Yes.
But they're tiny, they may be 250 grams.
Sure.
So there is a dosing to body weight issue. So in a human, 50,000 international units is a much, much lower dose that would be within a therapeutic range.
We
I would
have
thought.
a rather large group of people in our study, the D-Action study that I mentioned, that are taking 50,000 IU a day. All of them are working with a particular physician, but there's a large group of them. I mean, I don't know if it's 100 or not, but it might be in that range. And none of them, according to the physician, have developed any problems. That doesn't mean he doesn't watch them. He's an endocrinologist. But he has reason for this. So I just look forward to the time when the medical world, or whoever the powers that be are, can see that vitamin D, even in very high doses, we might call it toxic, but it's not anything like the toxicity of the chemotherapy drugs that people are on.
No. Although I think listening to one of the talks on the FDA approval of the vitamin C trials, if it's above physiological range, you need to treat it as if it were a drug.
That's okay too.
So I think if you're, the first step seems to me that if people are vitamin D deficient, we need to get them up to a level that would be optimal. That has to be the first step. This use of very high doses seems to be another issue. That if there is no harm caused by it, it should be a therapy or treatment that's available to people who want to use it.
I agree.
But at least the minimum that I think the message we need to get everyone to do is your levels are likely to be low, get tested, and then take action to restore it, which I guess comes down to a problem with testing. I think maybe 5 or 10 years ago vitamin D was not assayed regularly in clinics. Over the last 5 years, from what I've seen, it's now the most requested sample that needs to be done for a blood sample that's not necessarily essential, and it's expensive. So I think, and listening to some of the people talking about the immunoassays and the HPLC methods and the mass spec methods, there's some variation. So the absolute value, I think people are not necessarily sure what that means. So I think if there was a high throughput screening way that was cheaper and more efficient, that was just done routinely, like a blood spot assay with onto a Guthrie card.
We have that.
If that was widespread in practice, and then it was just sent off to labs, 396 well plates, run through MS, comes back, and then you can monitor at regular intervals. And so whether your levels are 40 or 50 or 35, you can get a baseline level for you and then see how it responds to something that's fairly safe, 400. Maybe it doesn't change. You go to 1,000, then to 2,000, and you work out your steady state level at an individual, and then knowledge would, really inform decision.
There we go.
Yep.
There was also another book that I read recently about institutional change. And institutional change comes about with advances in measurement. Measurement.
Yep.
And so the very fact that we can measure vitamin D, I think, is a big plus to being able to ultimately solve the problem. Thank you.
Thank you very much.
Very, very much for this interview. I very much appreciate it, and we will stay in touch, and your video will be posted for the benefit of all the people that pay attention to Grassroots Health and our vitamin D program. So thank you, Dr. Burne.
You're welcome.
All right.
Thank you for listening in to the first interview for today. Next, we have an interview with Dr. Kelton Tremellan on vitamin D and fertility. Dr. Tremellan completed his training in obstetrics and gynecology in 2001. Following his specialty training, he commenced subspecialty training in reproductive endocrinology and infertility. He is the clinical director at Repromed and an adjunct associate professor in the School of Pharmacy and Medical Sciences at the University of South Australia. His clinical interests include male infertility and recurrent miscarriage. And with that, we are pleased to bring you this interview on vitamin D and fertility.
All right, we have with us today Dr. Tremellan from Australia, who just gave a brilliant lecture here at the Linus Pauling Institute about diet and optimum health, and he spoke on the role of micronutrients in human fertility. And I would like for him to talk with us all a bit more about what some of those things are that happen when one is adequately nutrientized. We can invent a word as we go, right?
Sure.
But what are some of the key messages that you already conveyed in your speech that you could share with our audience, and really big hitters? What do you see as the really big things right now for fertility?
Well, I guess now with IVF being so successful, people tend to think
Tell us what IVF is for those that don't know.
In vitro fertilization.
Thank you.
So basically creating embryos in culture and then transferring it to the woman. I mean, that's so successful now that people are maybe not thinking as much about the more simple things we can do to assist fertility. And there's some very good evidence that micronutrients can assist fertility both on the male and the female side. So my research area is primarily in antioxidant micronutrients, but there are many other micronutrients beyond antioxidants, including vitamin D, which play a key role.
Right. What does this micronutrient have to do with the male side of things? What kind of things happen?
Well, on the male side, I guess the key micronutrients are the antioxidants.
Okay.
So like the vitamin C, the vitamin E, lycopene, zinc and selenium. And so they help protect the sperm from being attacked by free radicals, oxygen-containing molecules that can damage the sperm and reduce its swimming activity and reduce its capacity to bind to the egg. But also, most importantly, the free radicals can damage the DNA of the sperm. And that can lead to miscarriage, reduction in conception, and maybe even health consequences for the child. So that's, I guess, one group of micronutrients. Another is vitamin D. We know that vitamin D deficiencies are quite common in men, and vitamin D is important for maintaining the swimming activity of sperm. And so men who are deficient in vitamin D tend to have tadpoles, sperm that don't swim as well, reducing their fertility. But also they have quite marked reduction in testosterone production, so they don't feel as healthy as they could.
Fantastic. I didn't know that.
Yeah.
That's
of course, we all know that men are driven by testosterone.
Of course.
But testosterone is important for men's health beyond just reproduction.
Yes.
A bit like the menopause in women, lack of female hormones, estrogen can have cognitive effects. Men who don't have enough testosterone do feel lethargic, depressed, a lack of oomph, and it can really...
You mentioned a seasonal effective
thing
with
well,
that as well.
We know areas of high latitude, there's big variations in obviously sun exposure, and therefore vitamin D levels. And because vitamin D is linked with testosterone production, you could hypothesize that one of the reasons people get depressed during the long winters is lack of vitamin D and the lack of testosterone. I mean, it's an association that it's not proven as a causation yet, but it's certainly a reasonable hypothesis.
I liked your earlier comment that you made just a minute ago, though, the vitamin D or other things have such benefits, why not? Could you expand on that just a little bit?
Yeah, I guess what I was saying here is that quite often medical practitioners are slow to adopt things. And I think that makes perfect sense if you've got a therapy which potentially has harm. The Hippocratic Oath, first do no harm. But if you have a therapy which, like vitamin D treatment, which is unlikely to have major harm, is not expensive, even if there's just good suggestion that it can work rather than absolute definite proof, then I would say, well, why not try it? But not every doctor looks at things that way.
Right.
Yeah.
It seems, or it appears in some of our presentations, that a lot of them are rather almost frightened of trying something like that. So
yeah, look, medicine is a conservative profession.
that's true.
It is true, and what it takes is a few key opinion leaders in the local area, people that other doctors look up to. If they get on board with the therapy, then the others follow. And so it's important to generate those key opinion leaders in the important fields.
Of course. Tell us about the women with vitamin D and or fertility, please.
Sure. Well, vitamin D also plays a role on the female side. We know the number one cause for not ovulating in women is a condition called Polycystic Ovarian syndrome.
Okay.
These are women who, for your information, tend to be overweight generally, and a lot of them have insulin resistance, that is, insulin's not working properly in their body, and that insulin drives testosterone production in the ovary, and that interferes with ovulation. Now, we know that there's a greater proportion of these women with polycystic ovarian syndrome who are lacking in vitamin D compared to women who ovulate naturally. And we think they're linked. We think that because we know that the receptor for insulin has a vitamin D response element, that is, it needs vitamin D to work, you could imagine if there's low vitamin D that you could have low insulin effect. and that drives up the body's insulin levels to try and compensate, and then that creates this particular condition. And indeed, there's been some studies suggesting if you give vitamin D, you can improve ovulation rates. Not great quality studies, still small, early pilot
You can
studies.
also lower insulin resistance with added vitamin D. There have been studies about that as well.
Exactly.
So it is linked to
In that group,
for sure.
it has been linked
Sure.
with a reduction in insulin resistance.
Right.
And indeed, in pregnancy, it's also been shown to have that effect. So in the Hollis study that you alluded to earlier,
Right.
when they took women who were pregnant and they gave vitamin D, 4,000 international units, you did get a reduction in glucose intolerance in pregnancy, which is obviously all related to insulin effect.
Right. And what do you actually do in your profession, in your practice, with other nutrients? I mean, you don't have to limit everything to vitamin D, all that certainly is my specialty, but
Sure.
carry on.
Well, look, up until probably a year, 18 months ago, I didn't concern myself with vitamin D. So, but since then, we've been routinely screening women for vitamin D in my practice, which is primarily looking at couples who are
Was some of
infertile.
this as a result of the Hollis-Wagner study?
Well, that was one of the triggers. Yeah, I guess I'd read several papers that had increased my interest in the area, and I already knew that vitamin D deficiency is so common in the population.
Yes.
It really is very, very common.
Yes.
In fact, it's probably only about a quarter to a third of the population are replete with the hormone.
Right.
So it made sense that, given that it can affect ovulation,
Right.
given that it can affect pregnancy outcomes, we've already mentioned gestational diabetes, but also reduce preeclampsia
Sure.
and preterm delivery,
Right.
then I thought, well, it'd be remiss of me not to screen my ladies for it. So we do, and those that are deficient, we place on a supplement.
And what do you consider deficient at this point in time?
Well, anything under 75 nanomoles,
Okay.
that's what our laboratory uses.
Okay.
I know there is talk about perhaps that should be higher, but that's what
The
we
study level in the Hollis-Wagner study that their people got to with a 4,000 IU was right at 44 nanograms per ml, which is 88 plus 20, over 100 nanomoles per liter.
Yes.
Our group, the GrassrootsHealth group with our panel of scientists, they actually have reached a consensus, believe it or not, that the recommended serum level ought to be between 40 to 60 nanograms per milliliter or 100 to 150 nanomoles per liter. It's safe.
Of course.
And according to other research reports, even those which have just come out, the various African tribes that still exist have ranges above the 40 or the 100 nanomoles per liter. So if you wish to go up higher.
I don't recall the reference name, but there is one study in the IVF setting which did suggest excessive levels of vitamin D in the follicular fluid could have a harmful effect on conception. So I'm mindful of that particular issue.
Be interesting. Do you happen to remember what the excess levels mean?
I can't remember off the top of my head, no.
Okay.
No,
At your convenience, I'd like to know the reference.
sure.
Thank you very much.
That's right.
So come back to the focus of your practice, though. You deal with the whole fertility issue. Has your practice changed then over the last few years in terms of making people micronutrient replete?
Look, it's certainly changed in the last 8 years since I've become
Okay.
interested in this area.
Okay.
I mean, prior to that, for instance, I was involved in developing a male micronutrient supplement to boost the sperm function, a product called Menavit. And what happened was when I first started doing IVF about 11 years ago, I was noticing we'd had these men with really poor sperm, and we were picking up sperm and injecting it into egg, so-called ICSI, and thinking, well, that fixes everything. And yet the pregnancy rates weren't always that good.
Okay.
Embryo quality was poor.
Right.
And I looked into it and say, well, why? We're putting sperm in with the egg. And what happens is if they have a high degree of oxidative damage or free radical
Right.
damage to the DNA of the sperm, it gives poor embryo quality,
Of
poor
course.
pregnancy outcome. It makes sense. I mean, the DNA of the sperm is the genetic blueprint from the male.
Sure.
So I thought, well, this is silly. Why are we spending thousands of dollars on IVF when we're not dealing with the underlying problem of DNA damaged sperm. So that's when I started working on how do we block that damage with antioxidants and with trials, and took off from there. So routinely now we use antioxidant mineral supplements in the men before IVF.
Right.
In terms of the female side, well, we've always, of course, used folate.
Okay, right.
You know,
Sure.
that's been well established
Right,
in the last 20 years to prevent neural tube defects and others. But I guess we're now looking at other micronutrients on the female side as being beneficial, including iodine, iron, and vitamin E, vitamin D.
Sure,
Sorry.
sure. Do you track at all, or have you been able to follow through at all on the health of the infants and the children over the next periods of time of these women?
And correlate it with micronutrient intake?
Yes,
Look,
yes.
we haven't done any work ourselves in that area. Certainly there are data
Sure,
suggesting
sure.
there is a link. For instance, in vitamin D, your area of interest, there have already been studies linking maternal vitamin D deficiency with the increased risk of asthma,
Sure.
insulin-dependent diabetes, and possibly even schizophrenia
Right.
in the children in later life. So it makes sense that what happens in utero is going to have an impact on later child
Right.
development.
Right. Well, what else would you like to tell us? It's a very exciting field that you're in.
Thank you. No, well, it is exciting. You know, look, the ability to help couples have children is life-changing. Couples who can't have children naturally without some assistance, it has a major impact on their mental health. And when you can successfully help them have a family, it's a big plus. But I think, you know, I would encourage other physicians to look beyond just the merely mechanical means of assisting there, such as IVF, but also look at, you know, couples' diet, both sides, micronutrients, and of course obesity, which also has a negative effect on conception. Get that right if you can, and then move to the more high-tech interventions such as IVF.
I love it. Thank you very, very, very much.
My pleasure.
Totally, as I mentioned to you earlier, we're running our Protect Our Children Now project with pregnant women, and we have another project starting with the preconception stage, which would be ideal, but right this minute it's easier to get going with pregnant women.
Sure.
Who will be supplementing and doing their best to have healthy outcomes as well. But thank you for your talk, your time, and for coming.
My pleasure.
All right.
And best of luck with your projects.
Thank you very much.
Thank you.
Thank you so much for listening in today to both of these interviews. We hope you continue to participate in our webinars. We are actively seeking sponsors, and if you are interested in sponsoring a session or contributing in any way, we encourage you to log on to joindaction.org today or email us at webinar@grassrootshealth.org. Please tune in next week for our next Linus Pauling Institute webinar interview with Dr. John Fennell, Program Director and Clinical Research Scientist at the AOMA Graduate School of Integrative Medicine. Dr. Fennell will be speaking about vitamin D and aging. We look forward to having you join us next week. Thank you so much and have a lovely day.